put on our serious hats here. And one of the issues we've been following since last week was the moving of the maternity ward, the neonatal ICU, and I believe the pediatric ward from the COVID hospital, which is Guam Memorial Hospital, over to the nice spick and span non-COVID hospital, which is the Guam Regional Medical City. And there are just so many different things being said about this move that we couldn't really get to the bottom of it.
Right. Lillian Posadas, the administrator over at GMH, was saying, it's only talks. Nothing's been finalized because it is a detailed move, because you're talking about 4 different divisions that have to be moved over to GRMC if in fact it does take place. But in the meantime, you have organizations like Concerned Mothers of Guam that have written the governor requesting that this move takes place. And so we have on the line Jurong Gondole, and she actually just gave birth over the weekend. Jurong, are you there?
Yes.
Okay, so
first of all, congratulations.
Thank you.
Was it a boy or a girl? And what's the name of the baby? Girl.
Her name is Camelin.
Camelin. Oh, nice. A little tribute to Our Lady of Camelin, obviously, right?
Yes.
Let's just start at the beginning. How were you involved with this
Concerned
letter?
Mothers of Guam.
Well, it all started, of course, because I was pregnant, and initially hearing about COVID reaching Guam, I was nervous. And knowing that there were patients at GMH, of course I don't want my give birth there. Potentially having my child or me or my family exposed.
So when was this letter that you wrote?
I wrote it about last week. Yes, last week, Thursday or Friday.
And it's not just a letter; it's actually a petition.
Oh yes, I started the petition a day before the letter, actually.
Right. And so we heard that you gave the letter and the petition over to somebody from the governor's office. How'd that work out for you?
Yes, I received a response. She said she was relaying the message, and that's the last I heard of it.
She?
Who?
Oh, Crystal Paco, yes.
Okay, so you sent that over to Crystal last week, and she said that she would relay the message to the governor, right?
And so you haven't got a call back or an email. Did you check your spam folder maybe?
Nope, I have not received anything. And I ended up having to give birth at GMH. I was hoping it would be soon, but my time came up.
How many people had signed the petition?
Right now, we're over 2,500 people.
Oh, wow.
Yes.
Okay. And I think it says some of the reasons why they signed it.
A lot of people are concerned, having COVID and newborn mothers and expecting mothers in the same hospital, especially with the news about them finding a patient that was exposed and they found out days later.
Right. You don't got to explain anything then. I mean, it's pretty common sense when you've already had an exposure happen at GMH, and given that the maternity ward, am I right in saying that it's on the same floor as the ICU, or it's around the corner, or what's the deal?
I know it's in the second floor, I believe, and then the maternity ward's on the third floor. But, like going up and down the elevator or even the stairs, you see the patients or the employees walking through the hall.
Yeah, they have the protocols, these new protocols in place for expectant mothers. Tell me what you went through when you got there.
So when we initially came in, we had our mask and our gloves, but they tell you to sign in, and then they check your temperature, and then from there they tell you to go to the maternity ward. So they send a nurse down, and then the nurse walks you to the maternity ward, and then that's where you start either your treatment or your if you're going to give birth, they walk you there.
So you walk in through the emergency room, right?
No, not the emergency room, in the front of the room. So they kind of block off the emergency room, preventing anyone from going in there unless it's emergency.
All right, and then so what happened after you checked in?
After I checked in, I was ready going to labor. I had my IV put in, and I was on the bed. And then after delivery, they had me go to a room for recovery with the baby.
This was all on the second floor?
I believe it's the third floor.
Third floor, okay.
Yeah, but it's near the emergency room and X-ray.
So what were you being told by the hospital administration? Because in talking with Dr. Shea had said, "Oh, I went on a tour of GRMC." So what we're seeing and hearing from Dr. Shea, it's not really, and maybe there's some problems in the communication. It's not really matching up with what Lillian Posadas is saying, and she's kind of like putting the brakes on this. No, this is just a talk. We're not really sure. There's a lot of moving parts, which we understand.
Yeah, from what I know is Dr. Shea has been pushing it, but no one's agreeing with him, I guess. I guess there's a lot of paperwork or contracting that has to be involved with it.
Mm-hmm. And so now you've been discharged, right? You're back home?
Yes, I'm back home.
Mm-hmm.
And I can say my experience there, I don't feel safe at GMH, so I hope that they can move this as soon as possible for future expecting mothers and babies and families.
Can you explain to us after you gave birth the discharging process, because I think there was something there that troubled you.
Yes, to say I've had both of us had to go down to discharge, which is unusual because I've given birth there before. This is my third child, and usually one of us stays with our child. We came back and we found our child in the break room with multiple nurses. She was in her car seat already and on the cart. And we found her, initially we didn't find her where we left her, which was where the nurse's station was. They placed her car seat on top of the counter, and then we come back, she wasn't there. We looked into the room, she wasn't there, so we were in a panic, running towards the nursery because we thought they brought her back there. We found her in what looked like a break room with about 8 to 10 nurses.
Were they in PPEs or
were they wearing like the mask or the gloves?
They were eating and laughing and no mask or gloves or anything. So it was very upsetting because we've never experienced that before, especially in the middle of a pandemic. Our daughter could possibly have been exposed because we don't know if these employees have been screened or checked or anything.
Okay, let me just take this back. So you were going to be discharged, and they told you and your husband to go downstairs and wait?
Yeah, so they told him that he had to wheel me to the I guess checkout discharge area, which usually is a nurse.
Mm-hmm.
So yeah, coming back and finding that our child was in there with multiple nurses in a break room with multiple nurses was very disturbing for us.
What did they say to you?
I
mean, what did you say? What did he say when you guys finally found your Kamlin?
Yeah, we wanted to leave right away. We just asked to leave right away because we were just in shock that we found her there.
Did they say what they were doing? I mean,
they really couldn't answer. We just called the supervisor, and they're currently working on it now.
Okay.
Well, if we ask about this, what they're going to say is, and this came up in several calls with Lillian, is that, you're walking by the room, or you can only catch it this way, or you don't got to worry.
It's minimum exposure.
Right. But I think we've had some exposure at GMH, so you're totally justified in your worries and your concerns. Has there been any follow-up with you, after you being discharged?
I have not received a follow-up yet.
Mm-hmm.
I just got discharged yesterday afternoon, and I haven't received any call or email. But Dr. Shea is helping me with the patient care, I believe, and hopefully I receive an email or a call today.
What was it like being the maternity ward? I'm no stranger to that myself. So what were the patients there? Were you able to talk with any of them? What was kind of the feeling?
It was, we were mostly in our room, but by the time discharged, there was people walking. I saw some fathers walking out of the room, like going to the nurse's station, asking them questions. So people are walking around in that area.
Are the nurses in masks or anything?
For them, when they come into the room, they have masks and gloves, but walking around or at the nurse's station, I didn't notice any of them wearing masks or gloves.
So why do you think it's important that we move the pregnant women from GMH over to GRMC?
I just think it's safer because there's no real, having exposure to a newborn. I just think it's peace of mind having the mothers and the COVID patients separate, just for precaution and being proactive prevention.
And this is what we were told. We were told that as part of the pandemic plan response was that GMH was going to be for the COVID and GRMC was going to be COVID free.
Except for now, if you are pregnant.
Yeah, so only if you're pregnant, low priority, we're going to put you over there at GMH.
Yeah.
Is that how you felt? How does this make you feel? How did it make you feel? Was there a lot of anxiety that, trying to give birth at the same time as you're worrying about all this other stuff?
Oh, so much anxiety. If you saw us going into the hospital, we covered up all her bags, like in plastic bags. We had 2 gloves on, a mask. I mean, if we could wear goggles, we would have worn goggles too. That's how nervous we were going into the hospital.
And you shouldn't feel that way. That's
and I think if they move the maternity ward to GRMC, I think a lot of mothers and families will feel safer.
Yeah, and then you minimize the amount of traffic in and out of the hospital. I mean, all in all, it seems like a win. Have you heard, like, what's the real deal? Are they just, like, still mad at Dr. Shea for all the noise he was making? Do you think that's got anything to do with it?
I'm really not sure, but I just hope that they move it.
Have you heard from any other, because it says concerned mothers of Guam, have you heard of from any other mothers?
Yes, I've actually just comments mostly on other mothers that are scared. They're scared. They don't know what to expect. They don't want their child to be exposed. They don't want to be exposed.
Okay. Well, we thank you for calling, Jurong. If you do hear back from anyone in the administration,
let's get a message out here. What would your message be? I guess let's go straight to the top. What would your message be to the governor on behalf of pregnant women and the little babies at GMH and the pediatric patients? What would your message be to our Magahaga?
I would say please move the maternity ward to GRMC or at least a safer facility and please separate the patients, COVID patients and non-COVID patients, just to prevent it from spreading even more.
Well, thank you.
And congratulations.
Yeah.
Thank
so
you.
has anyone
the
named
future
their
black belt jiu-jitsu baby?
Yeah, you guys better move the babies or she's going to jiu-jitsu you. No, so has anybody named their baby COVID yet? Sorry.
No.
I did not see it.
Okay, just checking. Okay. All right. Thank you.
Bye, Jurong.
Okay, have a good morning.
Take care.
Yeah, so I don't know if we want to try and get Dr. Shea on the phone, but really Lillian has been, I don't want to say defensive, but she kind of has been defensive. It's like, no, this is just, we're talking about it.
Yeah, I don't know why. I mean, we get it. Yeah, we're talking about it, but these doctors we should have done this yesterday.
Yeah, and then
considering the fact that we've already designated the GMH as the COVID hospital,
right?
And regardless of these new whatever safety protocols that are in place, there's still this concern and this anxiety by pregnant women. I know if I was pregnant and I knew I had to go to the COVID hospital because, I was high risk, so I had no choice. I had to go to GMH, and I would be worried.
Yeah, and we haven't really heard anything out of the medical director from the hospital. And then, I don't know if you saw this. I put this on the chat. A letter here from the Fetal Diagnostic Institute of the Pacific. Dr. Hirata had wrote to Dr. Shea and basically laying out the case as to why, I can forward it to you, laying out the case as to why, like you would need to, these patients, pregnant women and a baby should be moved from the COVID. I mean, they're calling it the COVID hospital. Let's get them out of there. And you're calling GRMC COVID free, so not sure what the